Tell Me Why, that's the name of the show, and what we do here is we talk to children in schools from all over the four-state region. We ask them questions, or actually they ask us questions, and then we go to the experts who answer those questions. And we have the honor of having Dr. Beth Garrett from Freeman Health System in to ask or to answer a lot of the questions that were asked by all of the students in the four-state region about health. And it is just it's like a potpourri, and if you don't know what that means, it means a whole bunch of stuff in a little thing that smells good. It's like a potpourri of questions about health and related things. So we have done this before with Dr. Garrett. It was a resounding success, so we thought, let's do this again and help make people smarter. Are you ready?
I am ready.
Let's start with a handshake.
I'm so happy to be here.
That's really strong. Do you work out?
I do.
Everybody should work out. That's good. That's really good to start this off with,
is.
right? Okay, that kind of hurt a little bit. All right, so we want to know our first question. What is it?
My name is Riker, and I'm 7, and I want to know, why can't we stay up all night?
Boy, that is a great question, and I think everybody in the world who at one point was 7 years old wanted the answer to. Today on Tell Me Why, we're going to finally find out. Riker wants to know, why can't we stay up all night? Why?
Well, I found this out in residency when we were working those long hours. But we cannot stay up all night because we use sleep to recharge our brain and our body. When we don't get enough sleep, we actually can almost act like we're drunk, and we don't want to act that way. And then if we do this enough, we can get sick because our body isn't healing itself. We can make poor decisions.
Okay.
We can do badly in school.
And that's not good.
That's not good. And just in general, we feel more stressed, which can lead to some anxiety and depression and mental health problems.
Okay, most of our questions on Tell Me Why come from children, 7, 8, 9, 10, 11, all that. So my question for you along these same lines is, does it vary how much sleep we need when we're 7 years old, like Riker, or when we're 70 years old, like me? Is the required amount of sleep different for those two age levels?
It really does change, and you can go to healthychildren.org from the American Academy of Pediatrics to see how much sleep your child really does need. Usually children about Riker's age need about 9 to 10 hours of sleep a night. A lot of people want to put their kid to bed when they're done with sports, or maybe when mom and dad get home from work. That's a common one that I hear because I have a lot of families that work shifts.
Sure.
And then their kid is going to bed very late. And so it's finding that balance of, I want to spend time with my kid, but my child also needs to sleep.
And that's kind of tough. And does every family vary a little bit on how they choose to make that balance work?
They do. Everybody finds balance. And a really good rule of thumb is to find a really healthy bedtime routine. We want to somehow find a way to brush your teeth, read a book, go to bed, and do the same thing every night at the same time. And you'll notice I didn't say look at your phone or look at the iPad or watch TV.
I did notice that, yes.
Yeah. When we watch screens before we go to bed, it keeps us awake longer, and then it may induce us to wake up more at night.
Okay, so I think that's great talking about routines. Why are routines important? I think they're important for everybody, but are routines especially important for people who are Riker's age?
Yes, so for a child, when we have a good routine in place and Riker is doing the same thing every night at the same time, eventually his body's gonna say, you know what? It's 7:30, I'm starting to feel a little sleepy and I'm gonna start getting ready for bed. And that makes mom and dad's life a lot easier. And then he's getting better quality sleep over time. Now, a lot of families get frustrated because it doesn't happen the first week that they do it. It may take 2, 3, 4 weeks of you being consistent for that to happen for Riker.
But if you keep plugging, it'll probably get consistent,
Yeah.
and that way you don't even have to have a clock. You could just Riker can say, "Hey, boy, I'm getting sleepy.
Yeah.
Time to go to bed."
And you know, if it isn't happening, that's a good time to talk to your pediatrician or family practice doctor. The other thing is when we miss a child's sleepy point, no matter what the age, adrenaline kicks in, and guess what that does?
It makes you stay awake.
It does, and it's real hard to go to sleep after that.
Right, and that's something that happens with just about everybody. You want to avoid the adrenaline when you don't need it.
Yeah, it gives you that second wind, and we really want to avoid that, especially in children, because they don't understand why their body feels that way.
Sure. Okay, I've got one more question before we get to our next question.
Sure.
This is my own question. This is the one I came up with myself, but I bet a lot of people who are watching wondered this same question when you said a word a few paragraphs ago.
Okay.
Residency. You said you were in residency. Now that's something that many moms and dads, and certainly most children, they don't know exactly what that means in relation to what you're talking about.
Sure.
So what does that mean?
So in order to become a pediatrician, I had to...
A pediatrician is a child doctor.
Yes, I only see birth to 18, sometimes 21. And I had to complete medical school just like surgeons and cardiologists and internal medicine docs and family medicine doctors. So I did 4 years of medical school, and then for pediatrics, you do 3 years of residency. And we take call during that time, and we may be in the neonatal intensive care unit, we may be in the PICU.
What is a PICU?
That is a pediatric intensive care unit.
Okay.
We might be on the pediatric inpatient floor where kids stay when they're sick, and we take call. And when I was in residency, which was a little while ago, about 20 years ago, we would take call from 7 a.m. to 7 a.m., or we took call from 7 a.m. to 7 a.m., and then we didn't get to leave until noon the next day.
Oh, wow.
And
take call. What does that mean?
That means that we were taking incoming admissions from the ER
so
or
the kids
outside
come
hospitals.
in, and that's, if you're taking call, you get to see those potential patients.
Yeah, we help those families.
That's cool.
It was really good training, but you learn to do a lot with very little sleep.
That's good.
I wouldn't recommend it.
I'm not going to do it. If you say don't do it, I'm not going to do it.
If you need sleep, yeah. And I was very thankful to get some sleep after that rotation was over.
It's true. So I know I'm asking a lot of questions, but rotation, what does that mean in this specific instance? Like, that is just how you do your job, is that right? The rotation?
Yeah, so residents are actually doing a job and they're getting paid. They're not getting paid as much as what we call an attending physician, which is the boss,
right,
so to speak. But they change every 4 weeks or every month, depending on the facility that they're working at.
And it rotates.
Yeah, because you want to have training in each area of pediatrics so that when you are practicing in a clinic like at Freeman Children's Clinic, something comes to your door, you're like, oh, I remember seeing something like that. And you're able to handle it. Or when you're doing education, I still do a lot of education. You're like, oh, I remember talking about something like that, or that has changed. I need to change my practice.
Fantastic. That's a great answer to not only Riley's question, but all the 17 different questions that I just threw at you. So are you ready for another one?
I am.
We're ready.
Keep
Let's
them
hear
coming.
it.
Hello, my name is Lily and I'm 10 years old. Can you tell me why we can see colors?
Man, this is why I love getting questions from young people, because they think about things that we thought about when we were young, but we forgot to think about them that way. I think. Anyway, Lily wants to know why or how do we see in colors? I gotta tell you this. I am so old, really old, you can tell, that when I was a little boy, televisions weren't in colors. They were in black and white. All the TV shows were in black and white. And now everything's in color. So that's how old I am. Anyway, why or how do we see in colors?
Well, I'm going to date myself a little bit, and I had a couple of black and white TVs.
You remember this?
I do remember black and white TVs, and no remotes, and going up and changing the channel.
Yeah, that was
I was the
horrible,
remote.
horrible years. You were the remote in
It
your
was such
family.
a hardship.
Yes, it's terrible.
So we see color based off of the structure of our eye and light. So say we had a red apple sitting in my hand. The light would bounce off of the apple, and it's going to absorb what is wavelengths of light, because in our light there are wavelengths.
And
then
they kind of go like this if you look at them with a particular type of instrument.
Correct.
Okay.
And it's going to reflect off the red light. And then that black dot in our eyes is called the pupil.
The guy right here in the middle?
Yeah. So it's going to come through the pupil, and then it's going to hit a structure called the cone. And I kind of think of it as the party hat of the eye.
Does it really look like a party hat cone?
I don't know. I'm just a visual person, and I'd like to find little ways to remember.
I like that very
And
much.
Color, I think a party hat is colorful, and so cone, it worked out.
And these are little teensy tiny
Millions
things.
of things.
But millions in each of our eyeballs?
Uh-huh.
Okay.
And so there are, different ones, red, green, and blue, if I remember correctly.
Those are the three cones.
Yeah, and
Okay.
they absorb at different rates based on what we're seeing. And then they take that information and send it down the optic nerve to the visual cortex and the occipital lobe, which is back here. And they tell our brain what we're seeing. And it happens so fast, we don't even know it's happening.
Really? And so in those three cones, and they're little bitty, little tiny, in your eyes, those three different colored cones can make every color once they're combined in different ways?
Yeah.
How did they do that? That's smart.
It's pretty fantastic.
It really is.
Now we're going to have a small portion of the population that is colorblind, and that is what we call an X-linked inheritance, meaning mommy.
X-linked
X-linked.
inheritance.
I'm going to do a little science on you.
Ooh,
So mommy passes it to son.
okay. Is it always coming from the mommy?
Mommies carry it
Okay.
and give it to the sons. Now, if mommy and daddy have both the X's, a daughter can get it, but it's pretty rare.
Okay. So most colorblind people, and explain what colorblind is.
So colorblind is where it's really hard to see, especially red and green, and maybe some of the other colors that are related to that. And so they may rely on other people to help them identify colors.
So if you're colorblind and you have a red apple in your hand, it may not look. This is sort of hard for me to wrap
It's
my
kind
brain
of
around.
hard for me too, because I'm not colorblind, so I don't know
think I
exactly
am.
how it's perceived.
Although my wife keeps telling me I am right before I leave the house to go do a job where it puts me on TV.
Yeah.
You're colorblind. Why are you doing that? But if they're colorblind, the red that they are seeing in that apple may not look red to other people. Is that sort of right?
Yeah, it's not going to look red like it's
Okay.
other people, and eye doctors screen and test for that.
And is that one of the first tests that an eye doctor will do? Is it important to know whether you're colorblind?
It is important, and I think they do it after toddler years when the child can really communicate well. And
Okay.
I hope that I'm not like stepping on any optometrists or ophthalmologists' toes, and I'm speaking correctly.
I'm sure you are. And if you do step on their toes, then they'll have to go to
Then
a
they'll just have to
podiatrist because podiatrist is a toe doctor. Am
That's
I right?
That's right.
Got lucky on that one, actually. All right, so we've got a pretty good idea why we see in colors. Do you think all animals see in colors, or do we
No.
even know that?
No, I think you do, because we know what cells see color and what cells don't see color. Not only do we have our color seeing cells in the eye, we have our cells called rods, and they do our light and shade, or a simplification of that's going to be black and white.
Right.
So say you're walking through the house because you need a drink in the middle of the night and the lights are off, and you can't see the color of the couch, but you know it's there because you can see that.
There's something there, and it's,
Yeah.
but you just don't know what the color is.
Right.
Okay. There's a lot of stuff going on up there.
It is, and when I do eye exams for checkups,
And you do those too as a pediatrician.
I do. It's not as much as they would get at an eye doctor. It's just
Okay.
looking. But when I see the optic nerve at the back of the eye, I tell kids I'm actually looking at their brain, because the optic nerve is attached to the brain.
So sort of that's true.
So I'll be like, I just saw your brain, and they're like, oh my.
Wow. Next time you're on, bring the thing, because I want you to see if there's a brain there. Because the lady who runs this show, Priscilla Mace, P. Mace we call her, she doesn't think I have a brain.
Well, we'll prove it.
We'll try. Okay. We don't want to stick our necks out too far on that. All right. Are you ready? Yours is going fantastic. Are you ready for another question?
I am ready.
Well, I think we're ready. So let's hear that other question.
Hi, my name is Charlotte. I'm 10 years old, and my question is, how do we grow?
Wow, Charlotte, that is a question that I couldn't answer, and so fortunately, we have the wonderful pediatrician, Dr. Beth Garrett from Freeman Health System, to answer. How do we grow?
Well, there is a lot that goes into growing. When we're little, when we're a baby and a young child, we have hormones in our body, like growth hormone and thyroid hormone, that are telling the cells to divide, and that's called mitosis. Little science lesson.
Mitosis.
Mitosis.
Okay, your tosis.
Just like your tosis, yes.
Okay.
And
Our tosis. Our tosi.
So the hormones are telling their bodies to grow, and we actually track that at the doctor's office. For pediatricians, it's another vital sign. We watch how tall they're getting, and also we watch their head growth.
Oh, the size of they call it circumference,
Head
right?
circumference, yeah.
Okay, and that is the space that goes around your head.
Correct.
Why do you track all of these things?
Because if we see those numbers flattening out, jumping too fast, or going too low, we know that there may be a hormone issue going on, or maybe there's a nutritional issue going on. Unfortunately, sometimes there's a social issue going on, and that child's under a lot of stress.
So stress can affect this. Gosh, that's really important to remember this. And I know that when you talk to your clients and your patients and the children that come in, how do you address how important it is not to be stressful? I mean, I know we're going a little bit off track here, but
Sure.
we talk about stress so much in our lives.
We do.
We don't think about children having stress.
So I try to reinforce that, if there are stressful things, maybe on the news or in their lives, that mom and dad focus on, or if I have mom and mom or dad and dad, what have you, that the parents keep the child safe and they focus on that. And that they can handle the adult problems, and that the child's job is to just be a kid, to eat, sleep, and to exercise, like play, and to learn.
Keep it simple. I think the adults would do better, I think, if they did some
Yeah.
of those things too.
Yeah, it's really important for a child just to be able to play, to eat good food, and to be loved.
Oh, it is very much. You're gonna make me cry here, I think, Doctor. So that's how we grow, right?
Yes.
And when does the growth process slow down? Like, for instance, I was expecting to continue to grow taller, and somehow or another that didn't happen when I got to a specific height. I would have preferred it kept going. Why did I stop growing taller? I'm not very tall.
Unfortunately, I get to be the bearer of that bad news
Oh, no.
sometimes. Especially teenage boys are not happy about that. But we have 3 stages of growth when we are in the mommy's tummy,
Yeah.
the embryo/fetus, when we're a child/adolescent, and then
And what years
as
would
an
those
adult.
be? The adolescent years.
So adolescence really, I think more back towards 11. A lot of people
Okay.
socially think 13, but I'm thinking 11.
Sure.
And so when kids hit puberty, which is, when I'm talking to a family, I tell the child that's where you go from being a kid to being a teenager and then an adult.
Right.
And everybody does it differently. There's nothing you can do to speed that up, to gain muscle bulk, or to get faster, whether you're a boy or a girl. Everybody's gonna do it when their body says to do it. And your body is primed to reach a certain height. And you have growth plates that are going to divide for so long.
Growth plates.
They're going to be in the long bones of our body for a lot, and then in our hands and our feet.
Okay. All right. I didn't know that.
Yeah. They help our bones grow so that we can become adult size. And then the next stage of growth is adult, that we don't keep growing taller. Hopefully we keep maturing and gaining knowledge and have a lifelong learning process.
Okay, so the physical part maybe slows down a little bit by the time you get to be an adult, but your brain doesn't physically grow, but it can get smarter and have more stuff in it. Is that right?
Yes, that's exactly right.
See, I should be a doctor, shouldn't
You
I?
absolutely should.
Don't say that. We're on television and people will look at that and they will go, no, not true at all. All right, I think we've got time for, how many more questions, P. Mace? 2 more questions.
Yeah.
So we're ready to
Let's
go.
do
Let's
it.
hear our next question.
Hello, my name is Benny. I'm 7 years old. And how do you make a prosthetic for people who need them?
Our bodies come in all different shapes and sizes, and for some that means that there may be limb differences. Maybe there is an arm missing.
And our limbs are our arms.
Limbs are our arms, our legs, and for some they may have a missing arm or they may have a missing leg. They still need to be able to have the function of that arm or leg, and that is a very personal decision. If they choose to get a prosthetic, they may not want to use one. And so everybody is different on what they choose for their body difference. When we have a person who needs a prosthetic, we refer that. I don't make them. You don't want me making anything.
All right.
But we have a very good clinic that we refer to, and we use our helpers, like physical therapists and occupational therapists. And then we refer to a place that has a lot of experience in making these prosthetics. And then as they make the prosthetic, they're gonna, make sure that body is healed. We want a healed person.
Because prosthetics, actually, they can be used in 2 different instances, if I've got this right. If they were born maybe without a limb, or if they were in some sort of an accident.
Correct.
Where they would lose a limb. That's when the prosthetics, which would be taking the place of the limb that isn't there.
You are exactly correct. And we don't want to put something up against raw tissue or raw skin. That would hurt.
And that's why the healing has to happen first.
Correct. And then they can make a mold of that area.
Like right around here, they would. And how do you make the mold? Is it with some sort of plastic?
Yeah, they have a special chemical that, kind of like when you go to the dentist and they take a mold, it would be something similar. And then they're going to make a special sleeve that is molded to that person's body that we can attach the prosthetic to. I say we, I don't do it, the parents do. And then they fashion a prosthetic using plastics and polymers that is designed especially for that patient and their needs. If you have a patient that is an athlete, they're gonna need a prosthetic, especially if it's a leg prosthetic, they're gonna need a prosthetic for their school days in their everyday life, and they're gonna need a prosthetic.
And will they look different? Mm-hmm. Okay.
And they're gonna need a prosthetic for when they run.
And that's when you see the Olympics and you see some people running and they don't look like feet, they kind of look like springy blades.
Yeah.
Is that what
That
those
is
are?
correct.
Okay.
That is correct.
So one person can have various different types of leg prosthetics or whatever part that they are being replaced with.
Correct. And the important thing to know, the pediatric population or children, is that they're growing. And I may have a child or adolescent that quickly grows out of their prosthetic, and we may need to write multiple prescriptions for that child over time, because what fit them at 11 doesn't fit them at 11 and a half, doesn't fit them at 12, because they're just going through rapid growth. And if I don't have them in a well-fitting prosthetic, they can get pretty serious breakdown of their skin.
Oh, and that's
And then they have to use crutches, or they can't have the prosthetic on their arm, or sometimes they even will have to have surgery to help get that healed. And so how this fits and how it functions for that child is supremely important and can make all the difference in the world. And then we have to really respect, does that person want to wear a prosthetic?
And some may choose not to.
Some may choose not to.
Okay, and if you're a child, you will have this discussion within your family.
Correct. You know, we've had kids that have needed discussions with various body parts, whether it's a limb, whether it's an ear, any part of the body. It's amazing what we can do now, and we have 3D printing. But we always want to respect that child and respect the family.
Sure. Man, fascinating. All right, I think we have time for one more question.
Sure.
So let's see what we've got.
What can you do to work at the state's hospital?
Sounds like somebody might want to become a health professional. Troy wants to know what you have to do to be able to work at a state hospital. And what is the difference between a state hospital and Freeman Health System? Is there a difference?
A state hospital financially is run by the state. So if we said a Missouri State Hospital, Missouri would be funding that, or if it was a Kansas State Hospital, Kansas would be funding that.
Funding meaning that's where the money comes so that they can open the doors.
Correct.
Okay.
Correct. To work in any hospital, it is fairly similar. You need to be trained, and there are many levels of jobs that work in a hospital, and no one job, in my opinion, is more important than the other, because if we don't do our jobs, the patient can't get care. And that's from the person that needs to clean the room to the person who runs the hospital. We all have to work together as a team to take care of the patient and get the best outcomes. And so there are many, many opportunities to work in a hospital. My only experience has been at Freeman, but if you wanted to work in a state hospital, I think there would be pretty similar. You could be a nurse, you could be a tech, meaning you took vitals, you could do the heights and weights of patients.
Tell us about vitals.
Okay, vitals are gonna be like your blood pressure, your temperature, your heart rate, how fast you're breathing.
All the stuff that they do when you first go to the doctor. They want to find all that stuff out.
Correct. And then also they do a lot to care for the patient from day to day. If you're in the hospital, you know, do you need some water? Do you need some food? Do you need help calling for food? Usually it's the tech that's going to take that question first.
And it all requires training.
It all requires
all of those
training.
People. And extensive training.
Yes.
A lot of real, there's studying and there's testing and all of that. And that's why doctors, like Dr. Garrett, go to school a long, long time. You know, you enjoy going to school. If you're a school-age child right now, well, you get to enjoy it for multiple years
Yes.
if you choose to become a doctor.
It's a long time to become a physician, but I would not make a different decision.
Really? Were you the age of a lot of our question askers when you decided to become part of the healthcare?
I think I might have been
world?
just a hair older, but I was pretty young when I thought, man, this seems like what I want to do.
Why did you choose it?
I'd always worked with children.
Even when you were little?
Yeah, well, I mean, when I was in high school
Right.
and college, I taught swimming lessons, I did children's church, Bible school, those kinds of things, and I really loved working with children. And I saw the opportunity in medicine that I could help kids stay healthy for a lifetime, and help with a lot of preventive health care, and be there to watch them from their first moments until graduation, which I've really had a lot of opportunities to do. And I really enjoy watching these children just grow and mature, and they say some amazing things. And just being with those families, it's a real blessing.
It sounds like you chose the perfect job for you. Were there any? What part of it was hardest when you were going through? Was this? I'm sure the studying and all of the college work was very difficult. Did you ever have a day when you thought this is just too hard?
No.
Never, ever.
I had a really great training program at the University of Missouri, and had a really great crew with me and my co-residents, and really had good attendings. And I felt like I came out with a strong education. And then I came out to work with strong pediatricians. So
You had a pretty good life as far as your career choices.
yeah, now I won't tell you I don't work hard. I work really hard, and I work very long hours. And there are times that I wish I didn't work those long hours.
Right.
But to see a child improve, to see them go from being sick to being well, that's pretty fantastic.
It is. Well, thank you so much. You're fantastic at answering these questions. Again, Dr. Beth Garrett, Freeman Health System, you have been the star once again of another Tell Me Why. And we've got a whole bunch of different ones with all different kinds of subject matter. Just poke around a little bit here on 4 States Plus, and you'll get to see some other cool stuff. Thank you, Dr. Garrett. Have
Thanks
a great
for having
day.
me.